Bismillahirrahmanirrahim. Assalamu alaikum students. As you know that in the morning session we have discussed general features of acute inflammation. Now I will be trying to reconcile the whole topic of inflammation in a very concise manner. Students, acute inflammation is defined as immediate and short-term response of living tissue towards an injury. Now, what is the sequence of events during the inflammation? Or we can say, what is the mechanism of acute inflammation? Students, as you all know that the basic mechanism starts from increased blood flow at the site of injury. This increased blood flow is because of structural changes in the caliber of microvasculature. Student, the next change is emigration of leukocytes, especially neutrophils, macrophages and monocytes at the site of injury. Students, in technical terms, this emigration of leukocytes towards the site of injury is called chemotaxis. Now, the third process to take part in acute inflammation is exudation of fluid. This is because of presence of neutrophils and other chemical mediators of inflammation like serotonin, histamine, platelet activating factors, complement system. All these chemical mediators of inflammation, they leads to exudation of fluid from the microvasculature and accumulation of proteinaceous material at the site of injury. Students, in gross appearance, gross means naked eye appearance, the area of acute inflammation appears as reddish, swollen, hyperemic and congested. This is all because of hemodynamic changes which I have discussed with you earlier. Now, microscopic picture. Student, the microscopic picture of the area affected by acute inflammation involves presence of neutrophils. Students, neutrophils are the main cells of the acute inflammation. Neutrophils, macrophages and to some extent lymphocytes. Along with these inflammatory cells, students, we have got proteinaceous exudative fluid at the site of acute inflammation. Now, types of acute inflammation. Students, types of acute inflammation include number one, acute exudative inflammation. Example is formation of blisters at the burn site. Burn. Next we have fibrinous. Again, to continue with types of inflammation, we have got number one, acute exudative inflammation. Example is burn, formation of blisters in the patient of burns. Next we have fibrinous inflammation. In this type of inflammation, we have got fibrinous material collected at the site of acute inflammation. Then fibrinous suppurative inflammation. Number 4, suppurative inflammation. And number last, hemorrhagic inflammation. Please give me the camera so that I may give you a closer look in a written manner. Students, you can see acute inflammation, the definition, cells of acute inflammation, gross appearance of the acutely inflamed area, microscopic picture and types of inflammation. Thank you students. Allah Hafiz.